Did everybody get the agenda that Julie sent out so we know how we'll spend our time together this morning? Yes, I see some head nods. Okay, very good. So we wanted to start with some introductions. And as you can see, we've got lots of wonderful people on, both from providers and the DD team. So we will kick it off with DD team members doing a quick introduction. Julie, we can see your screen.
Okay, excellent.
Okay.
So I'm just going to take some quick notes because we do have an opening round question, and it probably pertains more to the providers than our own staff. We wanted to make sure that you know, we have some new folks on board, and it's been months since some of you have maybe, well, I guess we're doing a lot of virtual meetings, so you've probably seen your program specialist, but we wanted to make sure that we could introduce everyone. So the opening question that we'd like, you know, everyone from the provider side at least to answer is, you know, just an outcome you'd like to see as a result of these sessions, something that you'd like to see come out of this. So I'm going to be taking notes based on your responses as we go. Let's see here. Joey, do you want to go down the list of DD staff while I take notes?
Yes, so it looks like on the agenda we've called out DD team members first, and I would say share your name, your role, maybe how long you've been at the division, and anything else that might pertain to. Certainly we want to hear from anyone who is comfortable sharing, you know, what you hope to come from these sessions. So certainly I will put that out there for anybody who wants to participate in that part of the opening round. So DD team, the first person I see is Amber, actually, and today is day 3 for Amber. So Amber, are you comfortable starting?
Yes, that's fine. I don't have a whole lot to tell, I guess, at this point. I've been here, this is my 3rd day, and I'm just kind of starting to learn about what our department does, and then hopefully be jumping in soon to actually doing what I'm doing while I'm here. So I'm excited to learn, and nice to meet everybody.
Thank you, Amber. And then I see Katie.
Sorry, couldn't find my unmute. Katie Kelly. I'm hoping to just let's keep that communication open and keep improving it. So.
Hey, Katie, will you share also your role and how long you've been with the division?
I mean, if I must. Been here for almost 2.5 years. And I am a program specialist for both our choices side and our family support side. And I am also the unofficial therapy guru for the division.
Thank you, Katie. The next person from the division I see is Jenny.
Hi, I'm Jenny Krieger. I have been with the division for almost 9 years. I am the senior secretary.
Thank you, Jenny. And then I see Kayla.
Hi, I am Kayla. I am an intervention and support specialist out of Brookings, and I have been here for 5 months. I also have taken on some program specialist duties in family support, so you might have heard of me from there as well.
Thank you. And then the next on my screen is Lisa.
Hello, I'm Lisa Cheddar. I'm a nurse consultant. I've been here 78 days. And I'm also program specialist for advance as of Monday. So I'm learning a lot.
Thanks, Lisa. And then the next DD team member I see is Augusta.
Hello, I'm Augusta. I think I've been here 23 days. So I am learning a lot about shared living, about potential technology, technological support options, and just, yeah, excited to step into my role further.
Thank you. And then Carrie.
Shepherd or DeGraff? I'll go if it wasn't me.
You.
Okay.
You, Carrie.
Hi, everyone. I'm Carrie Geppert. I'm out of the Sioux Falls office, and I am the Children's Support Manager, formerly in the Intervention and Support Specialist role. So happy to be on this team, and I'm looking forward to just hearing all the communication between the agencies and making sure we're all hearing the same messages and sharing the same messages. So thank you.
Perfect. Thank you. And then Jays, please.
Okay, I'm Jay Sollers. I'm the Waiver Administrator with DDD, so I oversee both Choices and Family Support 360. I am here in the peer office. I've worked for DDD for 2.5 years now, and I would say I'm excited to communicate and collaborate.
Thank you, Jace. It looks like Liliana.
Hi, I'm Liliana Borsia. I'm the financial program specialist. I do everything related with financial and money. I'm with the division for 6.5 years, and I'm glad to hear what the providers say and their expectations.
Thank you. Julie Drozbeck.
Hi, I'm Julie Johnson Drozbeck, and I work in the Sioux Falls office as a transition manager. I have been with the division for almost 24 years, and I'm looking forward to just being able to have this time to all be on the same page and be consistent with everything. Thank you.
Thanks, Julie. Cade.
Hello, Cade Anderson. I'm a program specialist for just got LifeQuest the other day, and I've mostly been in family support.
Thank you. How about Kim?
Good morning, everybody. I'm Kim Percival. I'm a program specialist. I've been with the division in a couple weeks. It'll be for 2 years. I am looking forward to us finally being on the same page when it comes to getting the same messages and collaborating together.
Thanks, Kim. It looks like on quick glance, maybe I've called out everybody except Julie and myself from the division. Did I miss anyone?
We have a few people who are attending the VR conference or had a couple other conflicts, so they'll hope to attend in the future, but yeah, we are missing a few folks today.
Sounds good. Julie, do you want to just take a minute to introduce yourself?
Sure. My name is Julie Hand. I'm the Assistant Director of DDD, and I've been with the division for, I guess in a couple weeks, it'll be 13 years. So my career is here as a middle schooler almost. I don't know if that's a good or bad thing, but I'm really looking forward to just having the opportunity to have regular communication and get feedback and be able to share updates on a more regular and consistent basis with you all.
Thanks, Julie. And then for those of you I haven't had a chance to meet yet, my name is Joey Uni. I am the Director of the Division of Developmental Disabilities. I worked with the division for about 8-ish years from 2008 to 2016, and then have come back just since August. So I'm about 2 months or almost 3 months returned into this role. So it was important for us that as part of the onboarding, we start to follow through on some of the goals, which is opening those lines of communication and building on the partnership. And so for me, that's really what I hope comes from our time together in the provider meetings on a monthly basis moving forward. For other introductions, providers, I will just continue to kind of call folks out unless you want to, someone's feeling brave and wants to start, and then we can just kind of do a round robin that way.
Hey, Joey, this is Brian Moulder. I'll start if that's okay.
Perfect, thank you.
And I'm going to start off by saying, Julie, I know you have a lot going on, but I believe there's some people in the waiting room as they've been texting me trying to get into the meeting. My name is Brian Moulder. I serve as the Managing Director at Volunteers America Dakota's Choices and Family Support Program. Been involved in this role for about 3 years. So as Julie says, she is a middle schooler. I am just in preschool when it comes to learning everything about IDD services. So thanks for having this meeting.
Thanks, Brian. It looks like if we're gonna go where we're identifying people, Laura, you would be next.
Laura Wemblin. Okay, I didn't know how many Lauras were on. Benchmark, I have been with Benchmark since 2016, and before that, Northern Hills Training Center. I'm the regional director for the West.
Thank you. And then certainly you can pass, but just a reminder that we would love to hear what you hope to have as a result of these meetings moving forward. And certainly you can pass if you're not comfortable sharing at this point as well. So
excited to meet everybody and see some faces for a while. See the same faces every day.
Thanks, Laura. How about Mel?
Hi, I'm Mel Bertram. I'm from Community Connections in Winter. I'm the executive director. I've been with Community Connections for 22 years. And I'm excited for increased communication between all of us.
Thanks,
and
Mel.
If Brian is in preschool, then I was just born.
Thanks, Mel. It looks like John Hackett, you're next.
Oh, okay. Hello, everybody. John Hackett. I am the state director for VistaCare. VistaCare is actually based in, it's a small privately held company based in Sheboygan, Wisconsin. And that's where I met the company. I ran a nonprofit DD company there for a while, but I have a long career in long-term care and DD. I'm a retired naval officer, and I got a doctorate in economics. I've done all kinds of little things. But the head of VistaCare convinced me to come out of an early retirement and to move to Pier. So careful if he wants to sell you something, run away. He's good at it, but I'm enjoying it very much. And I'm happy to be on this call.
Thanks, John. One of the additional questions as part of the round, if people were comfortable with it, was just sharing some of the expectations about some of the goals or the results of having these sessions moving forward. So just a reminder, you can pass if you would like to at this time.
I mean, one of the things is, particularly right now, I'm sure we're going to talk about the K waiver and all that, I'm relatively new to South Dakota. I understood the Wisconsin system well, so I get a little confused. So I want to make sure that, particularly right now with all these changes, that we really talk through and make sure that I'm managing all this properly.
Let's see, Shirley.
I'm Shirley Halverson, and I'm the director of the Disabilities Program here at Black Hills Special Services in Sturgis. I've been with the agency for 35 years, and I've been the director for 30 years. We have 7 family support programs and then support people in Sturgis, the Northern Hills, and in Hot Springs. What I'm hoping to get out of this is that we're all getting the same message at the same time, so improve communication.
Thanks, Shirley. It looks like Betty, if you're open to an introduction.
I'm Betty Vischer. I work at Lifescape. I'm a program manager here. I'm also the Theresa provider administrator. I guess my goal today is to get back connected with everybody. It's good to see all of you again.
Thanks, Betty. I see RHD.
Hi, everybody. I'm Kristen Grinnenboom. I'm the Shared Living Director for RHD.
Mackenzie Yost, the Director for Residential and Day Services.
I've been with RHD, I guess I didn't say that. I've been with RHD for 3 years, and Mackenzie started a month ago.
Yep.
So So she's new. And what we're looking forward to, as everyone else has said, continued and improved communication. Also just feeling like everyone's thoughts are being heard. As directors, sometimes it feels like your thoughts are falling on deaf ears. So I'm excited to open a new communication avenue with all the DD staff.
Thank you. How about Pam?
Hi. Thanks for having the meeting. I'm Pam Hanna. I've been with LifeQuest for 36 years, so I don't know where that ranks me in the whole preschool, middle, whatever. I'm the director here. We have 5 family support programs. We run the agency with choice model. We do shared living as well. We just got into that about a year ago. What I'd like to see is to probably have some real good communication. I think this is a great start to that, so that we all can understand some expectations. And probably a goal I also have is that we work together on when things come up, we brainstorm together and implement new ideas together as we move forward. Thank you.
Thanks, Pam. Amy Hoekstra.
Hi, my name is Amy Hoekstra. I'm with Lifescape in Sioux Falls. I've been with them for 29 years. My current role is manager of case management as well as program coordination. So I work on both sides, the case management side and the CSP side. What I'm looking forward to with these meetings would be just the open communication and collaboration between the division and all providers so that we do all have the same understanding of expectations.
Thanks, Amy. Brad.
Can you hear me now? Okay.
Yes, we can
All
hear.
right. Sorry, I got to get all the right buttons. Brad Sadoff with Black Hills Works out in Rapid City. Hello, everybody. To narrow this down to one, I guess I would say, you know, we're in a new reality right now, and we're going to be emerging from the pandemic. And it goes back to that saying, seek first to understand and then to be understood. And I know that from the DD perspective that you folks have a lot of pressures from places like CMS, even the governor's office and that, and being able to understand what you have going on in your world and to share what we're actually experiencing in our world. Resiliency has been tested to a whole new level over these last 7 months. And I would not say that's getting any better or easier. Actually, it's getting harder. Even, 2 or 3 months ago, I wouldn't have thought it could get harder, but it is getting harder. But I don't think it's been so busy and so sleeves rolled up just doing things that it's been hard to carve out time to talk, to plan, to share. And I do strongly believe that we need that format, because even while we're managing crisis and trying to work on coming out of the crisis, we've got to pause a little bit and understand each other's worlds, what we're battling, to have a common plan, be on a common page, and to work together to emerge strong.
Thanks, Brad. I see Jennifer up next.
Hi, I'm Jennifer Gray. I'm the director at Aspire here in Aberdeen. I started out calculating, I think today's my annual service anniversary. So I've been here 8,760 days. If you need to do the math, that's 24 years. So I guess I think my expectations are probably similar to others. I appreciate the opportunity for providers to give some honest feedback when there's, initiatives or changes or other kinds of things that the department is seeking our feedback about. And then, of course, I always appreciate the opportunity that, that you guys are considering that feedback very honestly and able to advocate for improvements or driving that system forward based on the information that we've provided that is in the reality of what we're facing today. So again, thank you for giving us this chance.
Thanks, Jennifer. Elizabeth?
Hi, I'm Liz DeBerg. I am the Director of Residential Services at Lifescape. I am in the same boat as Amy. I oversee program coordination, conflict-free case management, and then also am on the residential CSP side of things. We also are doing shared living, so that's been exciting to kind of delve into that as well. I think for me, the collaboration of this work group will be great once we get a solid foundation of the agendas and what we want to really push forward. I also would like to see fine-tuning and streamlining of systems so that it's not as cumbersome to get what is needed for the person.
Thanks, Liz. Dan.
Hi, Dan Cross. I'm the director of the association, and I think that this is a great idea. I do want to encourage the division to keep doing this with this kind of a meeting and have them regularly. More communication is perfect. It's great. We need to do this, especially during this time. So keep doing this. Thank you.
Thanks, Dan. Looks like Nathan is up next.
Hello, Nathan Stallinga. I'm the executive director at Dakota Abilities. I've been in the nonprofit world for 27 years, but about 10 years here at Dakota Abilities. I started out direct care, was a manager, was a service coordinator, did HR, spent quite a bit of time doing development, and now in this role since May. I'm looking forward to getting to know people better and looking forward to the partnerships.
Thanks, Nathan. Rhonda.
Hi, I'm Rhonda Shelsky. I'm the executive director at Dakota Milestones in Chamberlain. We're a choices provider. We also have 2 family support programs, and we are an agency with choice provider. I've been here for 34 years, and I am looking forward to the communication and collaboration.
Thank you, Rhonda. Emily.
Hi, I'm Emily Oz. I'm the Director of Services for Sedbeck. And then come Saturday, we'll be co-interim executive director with Unella. Nick and Unella aren't able to join us for this call today. We're kind of teaming to try and get a couple of different things accomplished before Friday. So you get me today. I have been with Sedbeck for 7 months. And so I'm really looking forward to, I guess, the communication in these calls and just the ability for me to learn more.
Thanks, Emily. Steve.
Good morning, everybody. Steve Watkins, CEO of Lifescape. Unfortunately, Amy and Liz and a few others have to deal with me on a daily basis, so give them their prayers. But I've been here 2 years. Came from 31 years over at private equity, and probably have some different approaches than a few others, but hopefully you'll put up with me. In terms of the goals, really a couple of them, back to Brad's comment, seeking first to understanding the challenges that we both have in terms of delivery of our missions, I think will really help us understand how to come together on reality-based solutions. I think it's important that we understand the resources that are available and match the expectations with those. Secondly, I think over time, we'll be able to build a stronger bond of trust here through obviously this open communication and planning. And I think planning is a critical one as we look to new initiatives and things like that we work through, not only what the goals are, but how operationally we can effectively put those in play, to prevent surprises. I mean, now taking a surprise on right now it's a tough thing, particularly with COVID. So anything we can do to prevent surprises is incredibly appreciated. So thank you.
Thanks, Steve. Karen.
Hi, Karen Sedbeck with Benchmark. I'm the Southeast Regional Director here. Been in this role since 2016 when conflict-free case management began, so about 4.5 years. Really looking forward to the ongoing communication and the feedback and having that on a regular basis. And it's great to connect with everybody today. So thanks again for having this.
Thank you. It looks like Tasty is next on my screen.
Okay, I'm Tasty Dunwoody and I'm the State Director for Benchmark. I have been on since the beginning, so about 4.5 years. And with both the Director for both choices, case management and family support coordination. And I am excited to see everybody again. It's been a long time. And I look forward to listening to everybody and working together for positive outcomes.
Thanks, Tasty. Brian, looks like you are next.
Okay, can you hear me? Okay, I'm not seeing my video here, but I'm Brian Ardrey. I'm the Executive Director at Advance in Brookings. We're a community support provider. And I just echo what everyone else is saying. Looking forward to the teamwork, collaboration, everybody being on the same page. And I do think, as much as we're all zoomed out with Zoom calls, I do think this is a good format and will hopefully promote some more discussion and interaction than just phone calls, conference calls we've done in the past for different work groups.
Thanks, Brian. Jody.
Hi, I'm Jody Rhodes. I'm the COO of New Horizons. I've been with the agency for 32 years. I've been in this position about 5 years. And I'm just kind of like the rest. I'm just excited about hearing about what other people are doing, maybe sharing our challenges and sharing some of the things that people are doing to meet those challenges and just having that open communication.
Thanks, Jody. Looks like Donna.
Hi, I'm Donna Youthy with Valiant Living in Madison. I'm the Executive Director. I've been with Valiant Living for almost 23 years, and I'm new to this position. I'm about 1.5 years in. I'm looking forward to consistency and communication.
Thanks, Donna. Theresa.
I'm Theresa Marzon. I am with RHD Case Management. I've been with RHD for 3 years. I was with CFI for 10 years before that. I am the same. I appreciate conversation, guidelines, guidance. Feel like we've not had that for some time. So I'm looking forward to just hearing everyone and seeing how we can work together.
Thanks, Teresa. Colin.
Sorry, I'm used to GoToMeeting unmute. This one was a little tricky. My name's Colin Hutchison. I work for Benchmark Human Services. I'm the Regional Director for Central and Northeast South Dakota. Been with Benchmark almost 3 years. And I guess pretty much all the answers have been taken that I could think of. So I'm just going to go with consistency of expectations from DD is what I'd want to gain from these meetings.
Thanks, Colin. Kimberly, it looks like you're next.
Good morning, everyone. My name is Kimberly Marceau. I'm the Chief Operating Officer at Lifescape. I've been with the organization for 18 years. I appreciate the opportunity today, so thank you, Joey, for setting this up. I look forward to open, honest communication and building a very strong partnership with the division and other providers. Together, I believe that we can be very effective problem solvers and brainstormers to implement what we need to do for the people that we support. And just we can ensure that the solutions that are created are viable for all of the operations. So looking forward to that very much.
Thanks, Kimberly. It looks like Laura's up next.
Which Laura?
You.
Okay, I'm Laura Hazelrig. I'm with Volunteers of America. I am the Director of Quality Assurance and Admissions. I just echo all the other things. I'm here to learn.
Thanks, Laura. Julie.
Can you hear me?
Yes.
Oh, okay. My mic wasn't working. I was having some problems. I'm Julie Peterson. I'm with Live Center in Lemon, South Dakota. I've been here for over 29 years. I've been in the director position for about 4 years now. I'm really, like everybody else, looking forward to the communication piece and the partnership moving forward. I think now more than ever, we need that partnership, and it'll be good to be able to hear from the division and from case managers moving forward on things that we need to plan together on, COVID related and otherwise. But if we don't accomplish one other thing today, I feel like it's already a win, because I've seen the program specialists at the division, because they come and go so fast. There's names I don't recognize, but now I have faces to names. And over the years, when all hell broke loose and I've had to call the division several times a week, I've thought that Jennifer Krieger was my best friend, and this is the first time I've seen her face. So
Oh, that's a good story. Yes, certainly we want to have that face to go with names. That's all about relationships and the work that we're doing. And so thank you for calling that out, Julie. I appreciate that. It looks like Randy's next.
Hi, Randy Maindring in Huron. Yeah, expectations. I guess our expectations would just be that you keep doing this system of communication consistently over time. Communication is obviously broken down at different times, and that's not ever a good thing for the system. So if we can do this and do it consistently, that would be a really good thing.
Thanks, Randy. Tara Camp.
Hi, I'm Tara Camp. I'm the residential director at VOA Choices program. I think this might be my first meeting with all of you, so I'm just excited to get to know everyone and kind of open up those communication lines.
Thanks, Tara. Let's see. I might need some help from everybody. Is there anybody that we missed? Oh, yes. Gina.
Mute. There you go. Hi, everybody. I'm Gina Rudin. I'm the IDD Service Line Director for the Central Region, but South Dakota is in the region. So I oversee the case management and the shared living programs. And been with RHD for 3 years and looking for collaboration and continuity.
Thanks, Gina.
Yep.
Naomi.
Hi, I'm Naomi Even, and I have been with New Horizons for 20 years. I'm the case management and quality assurance program manager. So I work on both sides of the system in open communication and just listening to what everybody else is doing to handle situations.
Thank you. Beth, you're up next.
Hi, I'm Beth Cottle. Can you hear me?
Yes.
I'm working from home today. What I'm looking forward to is I've been at Ability Building Services for 35 years, and I've been the director for the past 7 years. And what I'm looking forward to is improved communications, clarity and timely responses in dealing with our current challenges and being on the same page going forward, and the ability to brainstorm together to help us all better support the folks we work with in today's challenges.
Thanks, Beth. It looks like Nikki, you are next.
Hello, I'm Nikki LaFortune, and I am with Volunteers of America Choices Program. I've been with VOA for a year. Previously, I was with RHD Case Management, and I too am just looking forward to open communication, knowing expectations, and collaborating as a group.
Thank you, Nikki. We had a little chat from Jerry. He had to step away, but I know there's a couple of people on the phone too. So who have I inadvertently left out as I was trying to scan through here? Please let me know. We want to make sure everybody gets a chance to introduce themselves. Anybody?
Joey, this is Carrie DeGriff. I unfortunately could not get signed in right away, so I came in a little later.
Okay.
You guys get the pleasure of seeing this side of my face, which that's unfortunate. I am the Quality Assurance Manager at the division, Program Specialist. I am the lead for CQL and NCI. Have been here for a little over 2 years, but have a history in the world of DD, working with CSPs throughout my life, and was also a case manager. So I understand all of the world.
Thanks, Carrie.
And I'm looking forward to the collaboration and transparency communication.
Thank you. Okay, who else? Is there anyone else who I might have missed? Somebody help me out if I did, or go ahead and speak up. I'm doing another quick glance. There's 51 of us, so I just want to make sure I didn't inadvertently miss anyone. Are we good?
Can you hear me now?
Oh, yes.
Sorry, I've been trying to talk. This is Katie Munson, and I'm on the phone. I'm sorry.
Hi, Katie.
Hi. So I'm with RHD Case Management, State Director. I am looking forward to these calls just because I feel that so my expectation is that we can build some trust and build some consistency amongst all groups so that we're hearing the same information. I think there's been some breakdown in communication throughout the few years that we've been working together as a system. So.
Thanks, Katie. Was there anybody else on the phone that we haven't heard from yet? Okay, I think we will consider introductions wrapped. It looks like we are on time with our agenda. So at this point, I will turn it over to Julie to discuss the standing items.
Okay, thank you. So, we sent out the agenda for this first meeting yesterday. So just kind of wanted to review this, and, we have a pretty basic agenda today. Most of our time is going to be spent on talking about expectations and introducing ourselves. Joey's going to provide some information about the Appendix K for the choices waiver, as well as Governor Noem's executive order, as suspended some of the regulations of compliance. And then we're going to kind of wrap up, again, talking about some of how can we use this time to meet our needs? What are maybe some of the topics you want to hear about or learn about or talk about? And then moving forward, we just I would anticipate that there will be some things that some of us will walk away from this meeting needing to follow up on. And so we will develop an action plan, very basic action plan, and talking about what do we want to add to our next agenda so we can be preparing for that for the following month's meeting. But other than that, we also want to assign roles. So we are on track so far. I'm taking some notes today. I guess I can probably stop sharing my screen. But we want to ask if there are any volunteers to be a timekeeper from this point on in the meeting, just to kind of keep us on track. We have some, rough timelines allotted to each agenda item, and certainly want to be cognizant of everyone's time. There is not enough of it ever. So any volunteers? So for those of you who might not be familiar, let me explain a little bit what the timekeeper's role is simply to pay attention to the time allotted that's listed on the agenda. And when we're getting close to expending those minutes, we've designated for a particular topic, just maybe add to the chat box or on your camera flash that, we have 5 minutes left or 1 minute left, and that we need to move on in the conversation.
I can do it. This is Shirley.
Thanks, Shirley.
Thanks, Shirley.
Yeah. And so do we get to mute your mics or no, just kidding.
Tempting.
Oh, I wish I would have known that when I was meeting timekeeper for a couple of meetings.
Thanks, Shirley. We appreciate you helping us keep on schedule with the meeting today. Thanks for that.
Thank you. Okay, so again, the number 3 agenda item, we don't necessarily have any actions today, but I wanted to keep this item on the agenda for future meetings because we'll be providing some follow-up on anything that we've designated as part of an action plan.
Thanks, Julie.
That takes us back to Joey.
Okay, so we are on number 4, if you are following along on the agenda, which is update regarding Appendix K and Governor Noem's executive order. So I had sent out that email with a brief update. We had requested the extension with CMS for Appendix K. That was granted, so that changes and moves our timeline to March of 2021. So for items covered in Appendix K, they have that extension. As far as Governor Noem's executive order, we are currently in the process of requesting all of the areas covered for DD that were a part of the initial executive order, that those would be extended. And so we are working to gather that summary at this point, and we'll be presenting it to the governor's office for review. And we are hopeful that that will be granted as well. And as soon as we have that information, we will update everyone as it pertains to what's currently in the executive order and our request to extend everything that's currently in there. So do you guys have any questions on either of those? Oh, great question. So Amy's asking, is the extension to March 1st or March 31st? And that is a fantastic question. And that's one of the things that we're seeking clarification on. We would like it to be extended to the end of March, but we are actually waiting from CMS to identify a specific date in March. And as soon as we have that, we will provide that update as well. Other questions?
Joey, this is Dan Cross. Do you have, so you're submitting that information to the governor's office on that extension. Do you have like any kind of sort of a time frame as to when you might be able to hear back from them?
I would guess, Dan, again, just a guess, I would say within 2 weeks we would hear. And we have requested that extension, at least right now in the form that it's in at this moment, to be in April.
Okay.
So I will certainly, do you guys feel like that's a reasonable time frame? We can talk through that if we have the ability to revise. We sure can. But at this point, we were trying to align it with Appendix K extension, was the rationale behind that. Great questions. Other questions or thoughts?
This is Brad. With CMS, is March generally the practice that they're doing with other states? Do they have like, we're only renewing these at like 3 months at a time or 4 months at a time, or any parameters like that?
So the parameters that we have is they've given every state basically a 12-month window. So for us, we made our initial request in March. And so we were able to use that window to extend our request to March because they have that already existing window. At this point, it's possible that we could have discussions and requests beyond that as needed. Right now, we are just going in with what we have the availability to request at this point. Good question, Brad. Other questions, thoughts?
Joey, this is John. Back to the K waiver. With the extension, does that mean we're back operating like we were prior to the September change?
Can you tell me more about?
Well, in September, we changed the way we could do the virtual supports, and anything that you started after September then had to continue. Is that? I'll talk to you separately about
Okay. That. So it just extends what we're currently doing.
Okay.
Yeah, and to provide a little bit of clarification, Julia and I had specified that the virtual supports and the guidance given, that's not identified in the Appendix K. Those are separate kind of policy identifications. And so just kind of providing that clarification that we have a lot of moving pieces. We have the Appendix K, the governor's order, and then DDD also made some policy decisions and changes in the meantime.
Thanks, Jace. But John, I'm certainly open to having a conversation with you outside of this meeting as well. And anybody who, if you're not comfortable bringing that forward here, then any of those conversations that happen outside of this group, we will kind of circle back and close that loop and summarize them as well. So we're on the same page with communication. Any other questions or thoughts on Appendix K or the extension for the governor's executive order?
Joey, there's a question in the chat box.
Okay. Has governor's declaration been extended to March as well? It is not at this time. So Shirley asks, has the governor's emergency declaration been extended to March as well? There is no extension on that order right now. So currently the executive order just goes till the end of December. And so our request is to extend it. So at this point, so it would be aligned with Appendix K.
If she doesn't extend it, then will that mean Appendix K isn't extended?
No, they are not tied together. We just thought that the timelines would make more sense if they were similar, so that we're, there's so many things that are constantly changing in communication. We just felt like that would be best at this point. So they are not tied together at all, Shirley.
Joey, this is Brian Ardrey. If the governor's declaration isn't extended, are there things that would stop in December then? I'm trying to remember what all was tied to what, but. Yes,
so I would say, we'll certainly know before our next meeting what the status is of that. And so at that point, we can make sure that executive order is on here, whether it's extended or not. And then we can decide as a group, we can talk through that as a group, what that will look like if it is not or if it is extended. Does that seem fair?
Yes.
Okay. Other questions or thoughts? Okay, certainly if you guys have them, please reach out to your program specialist, to Julie or myself. And again, if we have any of those conversations, we will make sure that we summarize those at our next meeting as well. So our next topic, following along in the agenda, is really working to develop a vision for these sessions each month. So how do we want to spend our time when we're getting together in this way? Just looking at sharing ideas for things that might be helpful for us to discuss and visit about when we come together in this way. So this is completely open format. Whoever would like to share ideas or how you'd like to spend our time together, please do so.
Well, maybe we could just go back to what, Jay's just briefly touched on, but that we could have a open conversation about the significant changes we've been told we need to do so that all of us as CSPs know, so that the conflict-free knows. Maybe we could just have a more thorough discussion of that to review it with everyone on at the same time.
Great. Is there any ones that you would like us to make sure that we address at our next meeting? Just anything COVID related? Is that that's kind of what I'm hearing, but I don't want to assume.
Well, it's COVID related, but also, okay, so we've been told we need to submit significant changes for people who are having virtual services. And if you only are Zooming with them for an hour, then your day program services are now an hour versus 40. And then we're told it has to be for 30 days, or is it 90 days? And, there's still a lot of things we need a little more clarification on. And then we as CSPs need to fill out the significant change. And then I'm really kind of confused about the ARSD rule that mandates that we call that a reduction in services. And I'm not sure where we're supposed to notate that it is the person's choice and not ours. There's just not much clarity for us, I guess, at this point. And then if the conflict-free aren't aware of what we're being told, then they don't know what to do with it when they get it. And that's also another, I think, barrier in this process that then we need to wait for the conflict-free to submit it. And there's not a way that we know when the conflict-free has submitted it to the division. I'm kind of rambling, but that's just, one issue that would be really nice if we could discuss it when everyone's on. Kind of like I said, my goal would be same information to everybody at the same time.
Absolutely. And if everybody's okay with it, we can certainly work to clarify those pieces that you've just brought forward, Shirley. And we can either send out in an email before the next meeting, or we can talk through them as a group in the next meeting as well. Is there a preference either way?
It's always good to get it in writing, I think.
Okay. Everybody good with that? So the division will do some work on our end to clarify some of those things that are outstanding or feel a little bumpy right now. And then we can send out an email to everybody that is a part of this group. And then if there's any outstanding questions from that, we can visit about that at the next meeting. So we'll make sure that this is carried over for an agenda item for next time. Does that sound good?
Joey, this is Jennifer. Are you open then to additional, other than Shirley's question, there may be, if you asked everybody through a round, we probably all have some varying kinds of questions.
Yes, Jennifer, absolutely. Like that is one of the points of having this conversation, is getting everybody together. If there's things that you're not sure about, or we're still kind of scratching our heads, like what is going on? This is our opportunity to work to clarify that. So while we might not be able to answer that here, the commitment is that we will get that answered and clarified.
Okay, so we can just send that in via email and you guys will put it on one document to come back out.
Yes.
Okay.
Joey, this is Dan. In terms of like a vision for these sessions, have you thought about, how often you're going to be having these meetings? Is it going to be like a quarterly thing or a monthly thing?
Well, actually, we would like to to do that on a monthly basis. And so I don't, if everybody feels like that commitment seems good at this point, we would like to do that at least monthly at this time, and then we can evaluate it as a group if it makes sense to keep it at that cadence, or if we want to extend it quarterly. You know, I feel like, especially right now in the pandemic, we have some heavy lifts. And so I would like us to be meeting monthly if that works for everybody.
Yeah, I think that would be a great idea to do, because I really think that this could be a really good productive venue for everybody. And then maybe, you know, is there gonna be like a call for agenda topics perhaps, you know, prior to, or maybe, you know, I guess you'd devise your own system as to how you'd send that out and the timeframes and stuff like that.
Yeah, so right now we're just looking about what are some of the ideas or things we want to do when we come together as a group. But yes, we will have a regular standing agenda with items that we will discuss as a group. Those items I would like to be generated by everyone. Certainly the division doesn't need to own what goes on the agenda in isolation. I would like that to be a group effort.
This is Brad. I'd suggest, I guess in my mind, I kind of see there being two overarching categories that we would probably want to work together and tackle. The first one being the crisis or pandemic management, because my belief is that's all still very real. We're in the middle of the pandemic yet, and there's still things we're all needing to do. Sometimes we learn what those are the day they're happening, each new day. But talking through some of that stuff so that everybody's got an understanding of what's going on there and what might be the best solutions on it. But the second overarching topic that I believe should be really good, is the recovery part, the post-pandemic. And I think that while we're in crisis management, we also need to be having a vision towards post-pandemic and recovery. And I happen to believe that things should probably look and work a little different post-pandemic, but I know what I believe and what I think. And I guess some of that we all have to be on the same page with, though, to make sure that's the reality, I guess. So pandemic crisis management, and then recovery and post-pandemic service delivery would be two categories I think would be smart for us to have on our mind.
Yeah, so if I heard you correctly, Brad, you're thinking our ideas and topics when we come together would fall under those two larger categories.
That's how it's...
At least for the time being.
That's how it's in my mind. Right, yep. And probably would, you know, crisis, God help, hopefully crisis management drops off and it's all moving forward stuff, so.
Yeah, other thoughts or ideas for time together in these meetings? You know, ideally, you know, I'm not sure if we're there yet, but something I would love to see happening is some information sharing, you know, from providers to other providers and to the division of things that maybe you've tried outside of the box that you were really successful with, or things that you tried that they didn't turn out the way that you thought. I feel like everybody on this call has a wealth of experience and knowledge, and it would be unfortunate if we didn't tap into that in these meetings to information share and to discuss things that we've learned through the process and how things could look different. Other ideas for our time together?
Hey, Joey.
Yes, Steve.
This may be more high level, and I just want to throw it out there, and you can obviously say no. A couple things. One, we're running into we'll be heading into the new legislative session. We haven't asked for $32.5 million of additional funding support to the governor. Dan, correct me if I'm wrong. We haven't heard a thing back from Governor Nome on that request. But is there a role that your team can play in helping us position this correctly, both with the governor as well as the legislature? I know talking to Secretary Rechtenbaugh that, I mean, obviously they follow the lead, the guidance from Governor Nome, and we're not asking anybody to cross that line. But if there is an opportunity to partnership in a way of establishing a credible ask to the legislature, is there a role that your team might be able to play there? That would be one. And then the other high level one is we've got the big freight train coming calling the HCBS settings rules that quite frankly will never be funded in any stretch of the imagination to the extent that it's required. I see that as probably the biggest freight train coming, and that's on top of COVID. And just asking if there's conversations there to be had. Again, I don't know if that's this level, if it's Secretary Rechtenbaugh. Just want to throw it out there as a couple of bigger ones that I'm looking at. And again, may not be appropriate in this setting, or maybe it is. I don't know where it fits, but would like to get those two out there as questions back to you.
Yeah, so I would say certainly the first one, that, you know, we would certainly want to explore that. How could that look to assist in some of those funding conversations? So yes, that is on the table for discussion. We can probably do that in multiple formats, but certainly that is not something that I would rule out, Steve. The second one, as far as HCBS settings rule, that's a big one. That's one of those big lifts. And so I think we need to have as many people in those conversations as possible. So I think that it would be appropriate to have those in this format.
Thank you.
And Joey, this is Dan Cross again, and along the same lines of what Steve had just mentioned, and Brad even, you know, I think in terms of like a vision for these meetings, I think we do need to talk about those high level things and not just have these sessions be solely focused on maybe more technical aspects of what we're experiencing. And while sure, we definitely want to know those things and talk about those things, I think it is a great format so that we can have more in-depth discussion on those higher level things coming down the pipe, because getting that message to everybody, I think, is really important. So, you know, if you could include that in these kinds of sessions, I think that would be really helpful for everybody, even though there's plenty of people on the line that maybe are not dealing, they're dealing maybe more on the groundwork of things. But I think it's important for everyone to know, you know, the vision for those high level things as well. So that's just my 2 cents on that.
I certainly agree with that as well, Dan. Other thoughts or ideas for how we can spend our time when we come together in this way? Well, I'd say we've already had some fabulous conversation. I feel like we have a clear kind of format or structure for when we meet the next couple of times. I would say this group can be fluid, so we can meet and discuss topics based off if something urgent comes up. You know, I want us to be able to be fluid in that communication as things ebb and flow. But at this point, Julie, unless you've got something else, I feel like the feedback that we've heard is sitting us pretty well for the next agenda. And certainly we'll request, and it's open to send other ideas for things that you would want to bring forward for the agenda for the next meeting, or even the meeting after that, if you feel like that might be more pertinent. So.
Yep, I agree.
All right, so we are moving on to number 6 then on the agenda, which is over to you, Julie.
Okay, so as far as, do we know what we're expected to do? I have too many documents open. I'm looking for the agenda. Do we know what we're expected to do before we meet again? So based on the notes I have, and I would say the significant change requests. So any questions that you might have can be emailed to DDD. I would say email your program specialist, and then we'll bring those together. Probably is the most efficient way to do that, so they can get compiled. And then we'll draft some, clarifying guidance, and then that'll be on our next meeting agenda. We will be sending out a monthly recurring meeting. I think we're going to aim for this same third Wednesday of the month, but the time, I know that there's some other things, at least within DDD, that happen on Wednesday mornings. And so we may look more towards the afternoon, but that recurring meeting series will be sent out in the next couple of days. Let's see here. And then in probably a couple weeks, we'll be sending out a request for any agenda items. But so far, what I have listed would be, and maybe I'm combining 6 and 7 a little bit here, would be the significant change requests and kind of opening some of the conversation about legislative session and funding and the HCBS settings rule. Those are pretty big topics. So we'll probably have to prioritize the timing of each of those. But that's kind of what's on our list for now, as well as the kind of within the overarching categories that Brad talked about with the pandemic management, and then looking forward to post-pandemic.
Sounds good. I think that's what my notes reflected as well, Julie. Thank you.
If anyone wrote anything else down, feel free to share.
I was just going to say that. Please let us know if we inadvertently missed anything, or if you've, now that you've had a little bit more time to sit with it, if you have other ideas for things we should bring forward too. Okay, hearing none at this time, then I would just ask that if anything does come to mind, that you please let us know, and you can do that again, either via your program specialist or Julie or myself for agenda topics. And again, just a big thank you to all of you for your openness to start the conversations and to continue the conversation to build that true collaborative partnership. I really appreciate that. All right. Thanks, everybody. Have a great rest of your day.
Thank you.
Thank you.
Bye.
Bye.